year is here, but achieving your goals might be a little more difficult if you aren't feeling very well.
Sinus issues could be blocking your success, but there are procedures that could help clear the way.
That's right, and Dr. Vincent Onrubia, founder and CEO of American Sinus Institute, is here to explain. Hello, doctor.
Hey, how are you guys?
Hello.
Glad to be here.
Great.
Now,
Good to have
first
you.
of all, sinus issues. This is just at our office alone, I hear people complaining about sinus issues all the time. So describe what some of these symptoms are.
You know, the sinus issues are varied, and they happen in different parts of your body. So the ear, nose, and throat are connected. So people that have ear symptoms, that could be sinuses. Ear clogging, dizziness. People that have sleeping problems, snoring, that could be sinus. People that have headaches, that could be sinus. People that have chronic infections, that could be sinus. So there's lots of weird symptoms that people don't often connect to their sinuses.
And we're seeing this long list of symptoms on our screen. So for some people who may just assume that they are, these are all normal issues, what do you have to, they should.
Well, that's a big deal. I mean, people that think snoring is normal. People sometimes think having headaches is normal. I think their headaches are migraines normal.
The migraine issue that you talked about earlier, back in the green room, there was, our makeup artist Cecilia had said, wow, I didn't know that my migraine could be sinus connected. So that's a really big deal.
That's correct. The number one trigger for migraine headaches is sinus disease. So you may have migraine, but if the trigger is the sinus and you eliminate the trigger, guess what? Now you fix your problem with your headaches.
We've all seen at the drugstore or grocery store sinus medicines that we can buy over the counter. Are these symptoms treatable just by taking a medication?
The problem with taking medication is oftentimes the medication works, but you end up having to take the medication continuously. And in general, if you're looking to get better health and improve your health condition, it's better to avoid taking medicines continuously because there's side effects, there's costs involved with it, and it's often not a recommended treatment.
What about doing those saline flushes or a neti pot? A coworker once told me about the neti pot where you turn your head up when you run.
Great stuff. Great stuff. Not a drug, not a medicine. It's basically just going surfing every day and rinsing your sinuses out if you live in Houston. If you go to LA, you could go in the ocean every day. Same thing, but it's very, very effective.
Now, Dr. Onrubia, you are the founder and CEO of American Sinus Institute. Now, the whole experience of coming into your office and actually being in there, we're seeing a bit of video now. Now, tell us a little bit about, welcoming clients in and your technique.
Our technique, a lot of people in Houston have heard about balloon sinuplasty, but our technique is something that I created using anesthesia in combination with a special type of balloon. So when you have the procedure with us, you have the procedure under anesthesia in the office.
And we're seeing the video right now of how it all works. So can you just describe what we're seeing?
That's the wire that goes through to find the natural opening of the sinus. Then the balloon threads through. The balloon then inflates. And then once the balloon's inflated, the natural opening of the sinus has been created. And then we rinse the sinuses out with saline. So not only do we open the sinus, but we're able to rinse the sinus as well.
So how do you ensure then that that passage stays open? Is this the type of thing that, A, do people recover quickly, and B, how do you guarantee that the same issues aren't going to happen again?
Patients recover quickly because the procedure is done by compressing tissue, not removing tissue. In the old days, we would remove tissue, creating bleeding, scarring, etc. Now with the balloon, all you do is compress tissue, no bleeding, no scarring, no packing, back to work even the same day in some cases.
Now, you are the king of that because it is actually called the Onrubia Sinuplasty Technique. And you've done over 11,000 procedures, right?
That's correct. 11,000 sinus procedures and about 3,000 of the balloon sinus procedures.
Now, doctor, so some people also complain of pressure in the ear or ear issues. How are sinus issues related to ear issues, or are they?
They're completely connected. The ear has a drainage tube behind the nose, and if the nose gets restricted, the ear can get restricted. So people may not be able to dive. People may not be able to fly. People may have dizziness, ringing in the ear, earache, and that's connected.
In the ears can even be related to sinus.
That's correct.
Now, what I really found interesting about that, and we were speaking a little bit earlier, is I'm an avid diver, and there were a lot of people who weren't actually allowed to go diving because they couldn't equalize, right? So actually having you do this technique, which you've done over 3,000 of that technique, will actually clear that up, right?
That's correct. We can go in and not only open the sinuses, but now Johnson & Johnson has developed a balloon that allows us to go in and open the eustachian tube as well. Just came out this year, brand new. Eustachian tube dilatation is what that's called.
So if someone comes in, like Stephanie Gonzalez, one of our producers backstage today, she was complaining about having some sinus pressure. How does it work when people come to see you? I mean, are they signing up for surgery? I'm assuming
When they
people
come to see us, they get a very extensive examination with a medical provider that looks at the sinus with telescopes and takes photographs. We go over their medications to make sure they're on the correct medications. Have they failed the medications? We do a CAT scan in the office, and we do an allergy test. So everything's done within about an hour on the first visit of the
and
office.
by doing the CAT scan, you're able to see which passages may or may not be blocked.
That's correct. And it tells us whether the patient is a candidate for medicine, medical treatment, or balloon treatment. In addition, having that allergy information tells us, well, maybe this patient just has a bunch of allergies. So there's different things we learn by that first visit when the patient comes in.
I just still think the long list of symptoms, I mean, the nose issues, the sinus issues, the ear symptoms, there's a whole long list of stuff that hopefully people can help.
That's
find
right.
relief.
And I want to get the word out there. What they're experiencing could be helped with a quick 15-minute in-office procedure that's covered by the insurance, that's done painlessly without any downtime, and basically an extremely effective way to cure your sinus problem and stay away from a bunch of medicines.
Okay, Dr. Onrubia, thank you so much for stopping by.
Thank you.
Being here.
And for more information on American Sinus Institute, you can call 713-BALLOON, which is 713-225-5666, or you can log on to americansinus.com. And thank you again, Dr. Onrubia.
Thank you very much.
Thank you so much.